These are familiar scenes at job recruitment exercises in Nigeria. There is a special difference in this particular instance though, as these are qualified medical doctors applying for jobs overseas.
Nigeria, like many other developing countries, has been grappling with the detrimental effects of brain drain, especially in the health sector. This shortage of skilled health workers directly affects the quality and accessibility of healthcare services for Nigerians. As of 2022, Nigeria's doctors to patients ratio is at 1 to 10,000 as against 1 to 600 recommended by the World Health Organization, according to the Nigeria Medical Association. From 1963 to 2023, Nigeria produced only 93,000 doctors, which is inadequate to cater to the over 200 million population in the country, as stated by the chairman of the association, Uche Roland. As of October 2022, only 24,000 doctors are left in Nigeria. Meanwhile, you would ask, what are the factors contributing to the brain drain in Nigeria's health sector?
There are a lot of causes actually, but the most important one is the poor remuneration that we are getting from government in terms of salaries, wages, and all that. Then coupled with the inadequate infrastructure, and of course we have done studies to prove this fact that the most important cause of brain drain in the health sector is inadequate remuneration. If you don't pay your doctors well, they are going to leave the country. And make no mistake about it, we are not even saying pay us what they pay in developed countries, because we know that Nigeria cannot afford it. What we are saying is that the salary structure we are using now was approved in 2009. That's 14 years ago. The same rate. It was implemented in 2014. That's about 9 years ago. And ever since then, there has not been any review.
The truth of the matter is that the first thing is employment. Even as we are complaining today that there's brain drain, there are many doctors who don't have jobs. The many doctors who started as doctors are now owning their businesses or are becoming accountants in other organizations. And then many of them, as I speak today, have moved into different areas because they can't find work. People will leave if they have a better option wherever it is that they are going. The Naira is not powerful as against any other international currency. So, and the countries that are taking Nigerians are mostly the UK, Europe, and then America. And then when they get to those places, they earn so much money.
On issues of remuneration, you could understand that we've run some campaign in Edo, Kebbi, Zamfara, Ondo, and some other part of Ogun and Bayelsa. We were meant to understand that there are people that are being paid, volunteers that are being paid as low as 7,000 naira, right? To help the medical officers in those primary health cares. And then that 7,000 naira has not been kept up to like payment. Sometimes they have a payment of a particular month, and then it will go after like 2-3 months before they will be paid.
The factors that contribute to the brain drain in Nigeria can be broadly classified into two. There are the push factors and the pull factors. Push factors in terms of the things within the country that cause healthcare workers, doctors, nurses, because it's not just doctors who are emigrating, right? That cause them to want to leave. And these are things that are related to the working conditions within the country. Things around remuneration, the fact that healthcare workers are not well paid here, working conditions around availability of personal protective equipment, availability of equipment, other kinds of equipment in the hospital that will make providing healthcare more seamless and more rewarding. Right. There's also the kinds of skills that they can build. I'm a medical doctor by training, and when you finish medical school, the first degree MBBS, you then have to do your housemanship, and then you have to do the 1-year compulsory NYSC service. And then you have to write exams to access postgraduate training, what we call residency, right? There are quite a few doctors who write those exams and used to struggle to get a placement for residents. So all those factors contribute to what we call the push factors.
One, the perceived lack of appreciation, I think I'm going to start there, of healthcare workers in Nigeria, especially medical doctors. And this would span a number of issues like them being underpaid, the working environment being hostile in terms of not having the adequate facilities, and not just facilities in terms of tools, but facilities in terms of the working environment, the consulting rooms, things like ensuring that consumables are present all the time, ensuring that you have light supply to be able to carry out your task. Because all those things lead to people actually having confidence and appreciating the work that they are doing.
A very huge contributor is poor remuneration of doctors, and so people prefer as going outside to seek better pay.
But the Ninth National Assembly, in a bid to curb the emigration of Nigeria's health professionals, introduced the bill proposing compulsory 5 years practice for medical doctors in Nigeria before leaving the country.
When the bill passed second reading, that was the first time it became public knowledge, and ever since then we stood against it. In fact, even the last warning strike we went on, that bill was part of the reason why that strike was called, because we believe that it is draconian. It is an enslavement. If you want to address brain drain, we have told the government what to do, and they know that that is the right way to go, and not to come up with any bill that will effectively restrict the movement of new graduates of medicine. That is against the Constitution. And the bill has gone with the Ninth Assembly. It was a very infamous bill, a very infamous attempt at trampling on the rights of Nigerian doctors. And we hope that now that it has gone with the Ninth Assembly, that this 10th Assembly will be more proactive, will look at better ways of addressing this brain drain. And I think what is happening is calamitous.
If you want to study medicine abroad, it's a very expensive course. Extremely expensive. And many times, even after you finish schooling and you come out to work, you pay for many years, whatever it is, even if you borrowed money to pay for your medical fees. But in Nigeria, the government subsidizes practically the whole study of medicine. Doctors pay practically nothing when they study. So if that is the truth, which is the truth, then they can put a caveat, and that caveat should have been done even before you start to study the medicine. For government to say, we are going to pay for the so number of years that you are going to study medicine, and after that, you are going to have to serve us for this number of years as a repayment or something for the amount of money we have paid for you to study medicine. That has to be the ab initio. That's one. Then, but for somebody who is, for instance, studying medicine in a private university, who didn't get this kind of what do I call it now? Who had to pay through their own schooling? Like now, if you want to study medicine in some of these universities, you pay as much as 8 million, 7 million a year, 8 million a year in Nigerian university here. And those are the private institutions. I don't think we have a right to stop those ones.
You can't stop healthcare workers from emigrating. No country aims to do that. What you can do is to make sure that you benefit from them emigrating. You benefit from the brain drain. What kinds of instruments and agreements do we have with countries that Nigerian healthcare workers emigrate to? How are we benefiting from them? What are our tax collection mechanisms? How do we remit taxes from healthcare workers in the diaspora? How do we do that? Do we have some sort of kickback mechanism with the countries that our healthcare workers emigrate to, whereby Nigeria's economy benefits from it? Are there such mechanisms and arrangements in place? This is what I mean when I say thinking in a very robust way about the brain drain issue and figuring out how to systematically solve for it.
Having identified the factors that cause brain drain in Nigeria's health sector, what then are the key incentives that will make health professionals in Nigeria remain in the country and attract health professionals outside the country to return to Nigeria?
There is no sector without accountability mechanism. And one of the things at Connected Development we've been advocating for is having a health sector accountability framework, right? That framework will sort of give social accountability, transparency to the system of health sector. You talked about people leaving the country to go and get better life. So the thing is, there's no health sector without proper financing. And we've had the Abuja declaration that says 15% of country's budget should go to health. And then we've not met that standard. So it's not just in Nigeria. And I think it's the continent problem. It's only South Africa that was close to getting up to that certain percentage. And when we come back to subnational government, that's in states in Nigeria, we've seen Bauchi coming up to that, and some other few states looking at political priority around that. So one of the first things that need to be addressed is the funding in the health sector, not just funding from government, but international funds, as well as private sector funding, as well as counterpart funding from the federal government and state government.
Increasing spending, for one, would address health workers shortages, because you need to pay your healthcare workers. But beyond that, it will also address more of the systemic issues that makes healthcare workers eager to leave. Right? If you have more healthcare workers, then health workers are less burnt out. They are more energetic. They are more able to work as effectively as they should. They also have more equipment to work with. I can't overemphasize the importance of being able to provide the kind of care that you know a patient needs, because you have all the resources available to you.
So when we talk about improvement in remuneration, that is the way to go. In fact, during our last morning strike, because we are still in contact with many doctors who have left the country, many of them were calling me from outside. And if government increases the salary significantly, they will come back. I can tell you that most of them that leave, they leave because of poor remuneration. So if government improve this salary significantly, not the paltry 25% we had that they are meeting, that's going to solve the problem. If they improve it, putting the data we presented into consideration before increasing this salary, can assure you that many of the doctors that have left the country will come back, and those who are planning to go will not go.
So if the government works on the reward system for doctors, I believe that people is going to address the issue of brain drain.
There should be a plan for trying to keep professionals, including medical doctors, behind by trying to finance things like mortgage. We're not saying it should be given free, but if the government pays a certain percentage and the person pays another percentage where they're able to own these homes, not just them staying there, they have more reasons to stay back in the country and work over time, to be able to ensure that, they can pay for it.
The first thing is, let them be employable. Employ them. And then secondly, when you employ them, pay them. In some of them, where they work in, especially some hospitals, private hospitals and things like that, they don't get paid. Security is also another issue. Many of all these doctors have to work in primary healthcare centers or hospitals that are in hard-to-reach places and security compromised places. There have been cases where health workers have been kidnapped and killed. One of my colleagues, who is also from the health sector, was killed. So I've said it all. Security must be sure. You must pay them their salary, what you have agreed, and the salary must be upped.
Investigations, special reports, analysis, and breaking news. Premium Times, a leading multimedia news platform, brings to you every minute stories that helps you make informed decisions and hold public officials, individuals, and organizations accountable. We have cartoons, videos, podcasts, and other interesting content for your delight. For timely update on politics, entertainment, sport and business, visit our website on www.premiumtimesng.com and follow us on all our social media platforms. Don't miss out.